I had a couple of ways that kind of my path into medicine. I mean, one of the exposures that I had to start off with is my mom actually developed breast cancer when I was a teenager. And so I got exposed a lot to the medical field and doctors and hospitals. And I mean, obviously it was a very trying time for me because she unfortunately passed away from her breast cancer when I was 16. So I had a lot of exposure to it then and felt like, this is something that I'd actually like to do, is take care of patients and work with them and help them to get better. I knew I wanted to go into pediatrics actually to start off with, and then I met someone during my first year of medical school, Dr. Grady Landry. He was a pediatrician, but he also did sports medicine. I'm like, this is kind of a neat combination. I like kids. I like to deal with healthy people. I like to deal with athletes. And then obviously now I do both kids and adults. I take care of both patient groups, but still my heart's always with the kids. The things I love to see and to take care of in my office, I love dealing with runners. I've been a runner actually since the age of 12. I certainly don't run as much as I used to. That's more of a time constraint than anything else, but certainly I love to run. I love dealing with the runner population. I think what's unique about what I do is, as a non-surgical person, is I'm kind of a jack of all trades. I see a little bit of everything. I don't have like one particular area that I target, so I can take care of someone's shoulder and then also take care of their elbow or their knee or their ankle. We can take care of all those things rather than just kind of being honed down into one particular body part. Another area that I really love to deal with is concussions, and so being a non-surgical person, I deal with the medical side of sports medicine too, and so obviously sports-related concussions are a very hot topic. We see it at all levels. I see it down in the little kids and all the way up until high school, college, and then certainly professional athletes that we deal with as well. One of the ways that I try and build confidence for my patients in dealing with me is I like to try and explain the problems to them, just like I do with educating medical students. I think it's important to know what you're dealing with and know the problem. One of the things I love to be able to do with patients is to be able to have them stay active and give them alternatives. That's the wonderful thing about sports medicine, is that these patients that I see tend to want to be active. They want to continue to go. They want to stay healthy. But we also have to give them some framework as far as what they can and can't do. And so we try and give them alternatives so they can stay physically active while they're recovering from their injury or their overuse problem. So they're not having to just sit around and become a couch potato, because that's not what they like to do. They don't mentally like that. And so we try and engage them in ways that we can still keep them physically active. I love working with patients. I love seeing them get better. I love working with the athletes. It's a unique situation of being able to work with an athlete, being on a sideline as an example, and being able to provide acute care right there and see a player be able to get back and do the thing that they love. I love being able to interact with my families and then having them come back and bring other family members back to me and saying, hey, we want you to take care of our child or my husband. And certainly from a standpoint, that's rewarding to me as a physician.